To the picture mnemonic for palliative anticipatory medicines, morphine is the first of the 4 anticipatory drugs. Represented here, by everyone's favorite childhood clay figure, Morph. Morph is kindly wearing his kappa. This is because morphine works on 2 main opioid receptors. The first of which is kappa. Thanks Morph. Mu receptors are the other main receptors agonized by morphine. Luckily, Morph's best mate, Mu, is here to remind us of that. Notice how there is a lamb. A lamb that is in the middle, or mid, of a target. It is also somewhat dazzled, as evidenced by its sunglasses. One may call it a midazolam. Midazolam is our second anticipatory drug. Oh look, there's now a stage. People who experience stage fright often become anxious and breathless. These symptoms also occur in the final days of palliative patients. Sharing the stage with the lamb is ABA. That is because midazolam is a short-acting benzodiazepine, which increases GABA activity. GABA is our main inhibitory neurotransmitter. Thanks ABA, cyclizine is our third anticipatory drug. It is used to help alleviate nausea and vomiting. This is clearly visualized by our cyclist, who is vomiting. Cyclizine is an antiemetic and an antihistamine. Our cyclist is cycling through a histamine-inducing meadow to highlight this point. The chemo trigger zone in the medulla is what controls vomiting. Cyclizine blocks the histamine receptors in this zone to help lessen nausea and vomiting. The more you know. Hyoscine hydrobromide, or alternatively hyoscine butylbromide, is our final anticipatory drug. There is a lot going on in this image. To explain, there are 2 brothers on water, saying, hi. Hyoscine hydrobros, if you will. Hyoscine hydrobromide is an anticholinergic drug. It is an acetylcholine inhibitor, represented here by inhibiting this chol. When patients near the end of life, they often have noisy secretions, as they cannot clear them from their airway. Hyoscine hydrobromide acts as an antimuscarinic and has an added antiemetic side effect. These are the 4 main drugs used in anticipatory prescribing in a palliative setting. Please remember to consult your local guidelines for up-to-date prescribing practices and doses.